Hey everyone, in this pre-lab video we are going to go over the placement of a nasopharyngeal airway. So the nasopharyngeal airway, or as we will shorten it for both this video and for class, NPA, is a soft plastic tube that gets placed inside one of the patient's nares and then passes behind the gag reflex to sit behind the back of the gag reflex, keeps the tongue off the back of the throat. So this is for an altered or unresponsive patient where we are already applying a modified jaw thrust or a head tilt chin lift to, just to help us secure and keep that tongue off the back of the throat. So an indication to place your NPA is an altered or unresponsive patient who is not able to maintain their own airway. Your contraindications are any type of nasal trauma, or if you suspect a basilar skull fracture, which is the part underneath the eyes behind the nose that the skull actually sits on. There have been a few documented cases of an NPA passing through that fracture and up into the brain cavity, where obviously it's not doing its job of keeping the tongue off the back of the throat. So the first thing we're going to do is make sure we have somebody applying our jaw thrust or head tilt chin lift, and then we will take our NPA and we need to measure it. So we measure from the tip of the nose to the earlobe. So tip of the nose to the earlobe. This looks like a pretty good sized one. Let's try one slightly smaller just to see. That doesn't even come anywhere close. And this much bigger one, that goes way past the tip of the earlobe there, so it would actually sit too low and could potentially obstruct our airway. So I'm going to use this 7 because it measured nicely. Once you've measured it, you're going to lubricate it. I'm going to lubricate over the trash so I don't slip and fall on the floor. You'll just apply some lube right to the very tip of the NPA so it passes easily. When we go to insert our NPA, the notch should always be towards the center of the nose. So we always attempt to place these in the right nostril first. I'm going to tilt his head so you can see a little bit better. So place it into the nostril slightly and then straight up and down so it's at a 90-degree angle to the patient's face. If you stay at this angle, it's going to get caught in the turbinators in the back of their nasopharyngeal airway, and it's not going to pass down correctly. So 90-degree angle to their face, nice gentle twisting motion until it's all the way in. Now, if while we are attempting to place this, we encounter resistance, that's what the twisting is to help with, but if we encounter a lot of resistance where we can't actually pass it past, don't attempt to force it. You can damage the airways and cause lots of bleeding. So if you encounter lots of resistance, stop pushing and we will attempt in the other nostril. So to place in the left nostril, still notch towards the center, insert a little bit, 90 degrees, gentle twisting motion, and a lot of times it will rotate itself completely around till you can get it all the way inside the patient's nose. And then it sits all the way in the back of the throat. It's really dark in there, so you won't be able to see it on the video, but in class we'll show you how it looks sitting in the back of the throat, keeping the tongue off of their airway. Now at this point, if your patient is breathing effectively, this can just stay in there on its own. If your patient is not breathing effectively, you can place a bag valve mask over this to ventilate them, and we will demonstrate that in another video.